You're now listening to the Adiel Gorel Show. Each episode, I'll bring you the latest news from my discussions with top health and wellness experts so that you can bring yourself into better health. Today, on the Adiel Gorel Show.
Right. It's a challenge. We have a cat, and she used to be indoor-outdoor. Now she's only indoor, but before we knew all about Lyme and all this other stuff, cats live a long time, you know? So
we were talking about Bartonella.
Yeah, and Bartonella, we have a couple species. Bartonella henselae, I think most people learn in medical school, as a causative agent of cat scratch disease. It can lead to things like bacterial endocarditis and even really severe eye problems like different types of ulcerations, conjunctivitis, even neuroretinitis. But most of it we describe as being self-limited, meaning we don't even know if you need to treat it, right? And that's usually from a cat scratch or a bite. And then we have other Bartonellas like Quintana species, which used to cause trench fever. And there are two main ones in the US. But we have some studies in the US and Europe that find Bartonella species in ticks. We have other studies that do not find them. So there's a little bit of a debate whether or not you can get Bartonella from a tick. There's a study out of Europe that shows if we put Bartonella into a deer tick and we feed it, like we let it feed on a mouse, it will infect the mouse. So at least it's possible. But other modes of other organisms that have been found to have it include spiders, sandflies, lice. And one of the things that I see commonly happen is that people will, like teachers I'll be talking to, will have like acute OCD or acute anxiety, or 4 or 5 kids with acute ADHD in their classroom after lice goes through the classroom. So whether or not this is truly from a tick where people are getting it or they're getting it elsewhere, we often will see it sort of concurrent, layered in, like a co-infection in people with Lyme disease. And when we treat, it causes a lot of the similar symptoms. But if you have very odd things, especially in kids, it can trigger like regression and tic disorders similar to a Tourette's, behavioral and educational sort of like scholastic regression. Even kids that are like 13 and 14 starting to wet the bed again, or even talking baby talk, it leads to a lot of like muscle fasciculation. So kind of a weird bug. And then all the same similar symptoms that Lyme causes. So we often are looking for both of these together. And like I said, whether it's you got it from the same tick or you got bit by the tick that came in on your cat, and at some point your cat also scratched you, they're concurrent. And when we have more than one infection, we often see that the symptoms are blurred. So that can delay diagnosis. But also when you have more than one infection, it's often harder to figure out what we need to address first. And then, the immune system is dealing with a lot more. So it's a lot harder to treat at times.
Bartonella on its own is just a regular bacteria that can be treated, with a course of antibiotics?
Yeah, it can to some degree. The problem is we don't have a lot of research on whether or not Bartonella becomes chronic. They're starting to look at that. It has a very close cousin named Brucella, and brucellosis, a lot of times from like raw dairy or skinning animals. We see this a lot in the developing world, so we have a lot more evidence behind that and what to do. And we know that our classic 6-week treatment with doxycycline leads to very high levels of relapse. Then if you do 2 antibiotics for 10 months, our relapse rates are in the 20 to 30% range. So I've treated you with 2 antibiotics for 10 months, and there's up to a 30% chance that you're going to have it return. And then in the world literature, they've done 3 antibiotics for 18 months, and then they have less than a 5% relapse rate.
Oh, okay.
So we're getting somewhere. So now, and Bartonella and Brucella reproduce probably anywhere between 2 and 6 times in one day, right? So strep maybe 13,000 times in a day, we're slowing down the Bartonella and Brucella probably a handful of times a day. Lyme, I've seen as little as every 2 days and as much as once every 6 weeks or 3 weeks. If it's in an active form, the persisters can lay in a test tube for 10 months before they open back up. So it's a different beast. But what we're seeing is as we extend the treatment protocol in similar bugs, we're more effective at the treatment. And so clinically for Lyme disease and Bartonella, we see that the longer treatments are really helpful.
So now there's a question that covers two sides of the fence. I mean, when you talked about the chronic treatment, and sometimes it can take a very long time with antibiotics, we know that antibiotics also cause damage to the gut. So, I mean, and you said the gut is a major part of our, so, we are destroying what protects us at the same time. How, I know you mitigate for it, but can you explain how?
Sure. That is one of the most important. I think this is where people get the most scared, right? I think that and antibiotic resistance, and 2 short antibiotic courses lead to resistance. But that's a different story. In our gut, I tell everybody, my assumption when I give you an antibiotic is that at the very best, I can keep your gut where it's at today. And I assume I'm doing way worse than that. So depending upon the number of antimicrobials I need to use, we're on 1 or 2 different probiotics that are bacterial species. We're probably also going to add a probiotic yeast in there to help prevent. The big thing we want to prevent is C. difficile overgrowth. That's kind of like one of the bad bacteria that's normal in our gut, but very low levels. If it overgrows, we can get infectious diarrhea and all sorts of bad stuff. And then also to your point, we can cause leaky gut and stuff. So my goal is usually 2 to 3 probiotics that are very high potency, monitoring how the person's gut is functioning. There is evidence that both Lyme disease, Babesia microti, which is a different Babesia species, and Bartonella henselae can be biopsied out of the gut wall. So I see a lot of people with like irritable bowel syndrome type symptoms, like especially with lots of diarrhea, that you put them on antibiotic, their stools actually get better. I'm still assuming I'm breaking your gut, right? You just have to. And there's all kinds of other natural things we can add in depending upon what a specific patient needs. But the higher dose probiotics and the diversity of probiotics are really critical in that. And then what I tell people is like, look, when you leave my practice as a healed person, your gut will be better than it is when you start with me. That's one of my promises, as long as you do what I ask you to do. And so we do stool testing and we look at other functional tests to make sure that we're optimizing gut function. Because what good is it, to your point, what good is it to be cured from Lyme and Bartonella if we've now suppressed your immune system? So I want everybody to be doing a lot better when they leave than when they showed up.
On the subject of C. diff, there was a period, and I'm sure you know about that very well, where C. diff was considered, incurable, until they came up with a fecal transplants. So now those seem like an easy, lazy man to fix the gut. I mean, what do you think about that?
Yeah, I think more research is needed to know if we should be giving fecal transplants to all kinds of people. I remember a couple years back, we were doing a physician training workshop, a day-long workshop at the beginning of a Lyme conference. And we're in the expert panel at the end with all the faculty. And somebody rightly goes, what about C. difficile? Don't you, with all these antibiotics you're recommending? And a colleague of mine's like, oh, you see it 3, 4, 5, 6 times a year. It just comes with the territory. I was like, what? I was like, I have seen it like 4 times in my entire career. Once I was a resident, and I just happened to, that was the person who got admitted. I've had one person that came to my practice, got 1 antibiotic pill from me and got C. diff. So they were a setup, but it was real and we treated it. And I had another person, same thing, but she was treated for like 10 months. And I didn't know all the circumstances because they left and then came back and told me that it had happened. The only person that I have a lot of details on who got it had a gastric bypass. After the gastric bypass, got Lyme and babesiosis, then couldn't keep weight on and had a feeding tube multiple times after the gastric bypass. So it's like, And then with all of this anatomical differences, needed to end up on IV antibiotics. And she had been on antibiotics with different practitioners about 5 years. This person got C. diff, wasn't able to treat it with all the other stuff, did very well with 2 fecal transplants, has been much better since. But it's rare. Like literally, I can think of 4 people that I've ever seen. If you treat it properly and you put the right probiotics and the other supportive agents on, the risk of C. diff is there, but you can prevent it. It's just like the tick bites. There's a risk of them, but let's do everything to prevent it so we don't have to worry about the fecal transplant unless we absolutely need it.
Well, actually, I was even without the C. diff, if the fecal transplants are effective, wouldn't it be a shortcut to restore, the gut in any way, in any case?
Yeah, it's possible. I mean, I think they're looking into it. A lot of the shortcuts don't work because then my concern is why do you even need it? So is there a lifestyle thing? Is there a dietary thing? Is there a toxin that you're ingesting thing that's killing it off? So I think the short answer is yes, it probably can be a shortcut, but again, just like lowering your blood pressure, we have shortcut pills, but then what you see is those shortcut pills, your blood pressure still goes up, and I give you a second shortcut pill and then a third one if I don't change what actually caused it. So if you have somebody who really wants to make a big shift, I'm sure that it could be a positive tool in your arsenal. But they have to do all the work.
We covered fairly okay how to be careful using that spray, the dogs, everything. So now you did mention keeping the immune system strong and healthy, sleeping well, all those things. Are there any other tips for us to do for those of us that, for the people who don't want to get it and want to fight it well, if God forbid they do, are there any other tips to keep the body healthy, the immune system well?
Yeah, I think this is the most important thing, Adiel, and I'm so grateful that you asked this, because I think the goal of all of us should become the world's worst infectious host. Our deer tick should look at us, spirochetes in the deer tick should look at us, and they should just run away, right? So make yourself as strong as you can. So a couple things I like to tell people to do. One, sleep is one of the most incredible things you can do. So in order to optimize your sleep, I start in the morning. I have people get up. I like to get sunshine and fresh air whenever possible. If not, and if you're in a climate where you have a medical condition where you can't go out, get some of those blue light, those full spectrum light bulbs, or even the blue light glasses that shine extra light in the morning. Start your circadian rhythm in the morning by getting the sunlight. The sunlight's going to trigger 2 main things. It's going to trigger your serotonin, your happy drug, to start being created. It's also going to trigger melatonin. We want to create melatonin when we're exposed to natural light sources during the day, so that when we turn the lights down and get rid of our screens at night, melatonin goes up and we can sleep. Because we also want to go out and move around and exercise, get that fresh air, make ourselves tired, right? So many of us, our work and our lifestyles have become not really all that tiring. They may be mentally tiring, but physically we want to wear our bodies out to some degree so that we can go to sleep. Part of the reason I say start in the morning is because by the time I get to the end of the day, I want to have a ritual of de-stressing. It could be breathing, meditation, it could be prayer, journaling, whatever it is. Something that at the end of the day where you throw your blue blockers on, or maybe you just use, like a yellow light without all the fancy blue in there, calm down, get off of the TV and stuff and let yourself chill, get yourself into a nice deep sleep in a cool, dark room. Because then when it's dark, that melatonin goes out. And we talk a lot about melatonin, but I think it's underestimated. Not only does it help you sleep, and it's a profound hormone for that, it has anti-cancer properties, antioxidant properties, and it's one of the 3 things that has actually been shown to block the main inflammation pathway triggered by COVID, which also happens to get triggered a lot by Lyme and our other friends. So you can take some melatonin, but you can also create your own. The other things are brain detoxification happens at night when you're sleeping. and it's primarily based on cerebrospinal fluid, which is mostly water. So we want to have people drinking water during the day, and we want to have them sleeping at night so that they can clean their brain. And then, there's a lot of diets out there. We all know that the processed foods, the Coca-Colas, the sugars, the whatever, are not good for us to have. And we should be looking at, I'm assuming that you can handle most foods. If you have allergies or whatever, work with a specialist, yada, yada. But get a rainbow of food, fruits and vegetables, primarily low glycemic index vegetables. Put some fat into your diet. So I'm a proponent of a plant-based whole food diet first. Add your protein source at the end. I don't care. I actually think that it's very hard to be healthy as a vegan or a vegetarian. It's a little easier to do as a meat eater, but you can do it any way you want as long as you do the right research. But you got to put lots of plants in. Meat eating diets, in my mind, are not to be bacon and steak and nothing else. We really need to get that roughage in and really get just like a lot of antioxidants. And the biggest thing, I think, is to chill the hell out. Find out a way. Play your guitars, right? Go for a walk with your kid. I've been admiring them. Mine are in the back. But, chill out. Whatever it is, you have to build in time to put yourself first. As a parent, you cannot take care of your children unless you care for yourself. As a physician, you can't take care of your patients unless you first take care of yourself. It is not selfish. And then of all these few things I listed here, pick one of them that you're actually going to do and just do one thing, because I just told you a bunch of shit. And I just want somebody to pick one of the things that we've talked about and do that first.
Well, some people say, look, I work hard all day, and then when the night comes, this is my opportunity to de-stress. I watch a nice series on television. I do a Netflix thing at night. So if they want to do that, if they have the urge to do it, should they at least watch the TV with yellow glasses?
Yeah, I think so. Blue blockers are good. My question is it really de-stressing, or are you just checking out? And every once in a while, I got to watch some TV. And I actually find that with our daughter, we're not saying no TV. We're saying, let's pick and choose so we can learn. And we enjoy doing it. And we learn how to cook better. We laugh. Laughter is key. So I'm just saying, just don't become a zombie, right? And some nights, I admit, I have to veg out. I think that's a legit thing. Put on your blue blockers or tint your screen, because you can use things on your computers, maybe not so much the smart TV, but balance it out and ask yourself that question. Am I really giving myself the food for my soul to nourish my soul that I need? It's like something about the early 2000 or 2002 Australian rowing team. Heard a great story. They said, whenever they made a decision, will it make the boat go further or faster? Meaning, will it move me closer to my goal? And you ask yourself that question, because on some Friday nights, going out and having a couple of drinks with the blokes is going to totally move the boat faster, because you chill out. But other nights, you're just going to have a couple of extra drinks and you're going to decrease your performance. So it's not about a hard, fast rule. It's about being honest with yourself about what you really need, and not just using 4 glasses of wine and 3 hours of television to pretend that you were de-stressing.
So, during COVID, for a while, we were locked down. Some people are in a relationship, some people have kids, and some people don't. Yeah. So we had on this podcast, we had several great people who talked about sex and love and heart connection. And I think, don't you think that should be a big part of health in general? I mean, they talk about the, oxytocin and all of this thing, but just preventing loneliness even, and then relationships and hugging and kissing and sex and all of those things, right?
So critical. I actually, a lot of my work that came out of mold, Bartonella, Lyme, and all this, I do this whole conversation on brain detoxification. And my number one tip is heart-centered breathing, right? And because if we die, when you look at the way the nervous system works, we talk about sympathetic and parasympathetic, or fight or flight, rest and rejuvenate. But there's been some research in the last like 12 or 13 years that's shown there's another aspect of that, of what we call parasympathetic. The one we mostly learn about is rest and rejuvenate. But the other end is, so if you think about sympathetic, right? Fight or flight. Saber-toothed tiger comes around our campfire, I turn around and I fight him. Or I'm like, oh my God, saber-toothed tiger comes, and I run. But in both of those situations, you believe you can win. You can either win by fighting or you can get away by running. If you can't get away, like a cat grabbing a chipmunk or a mouse, then you're in what we would call freeze state, because the mouse will play dead until the cat gets bored, drop it out of its mouth, and the mouse or the chipmunk runs away. You think that when you can't win, the only survival technique you have left is freeze. So we see this in our chronic illness population. Frozen, hopeless. And what you'll start to see is that kind of behavior. Eyes go down, they withdraw. It happens person to person, but it also happens, just like they're not going out, they're not Zooming anymore. And the problem with COVID is it heightened it happens in people who are infected as a result of what physiologically is going wrong, but it also can happen environmentally from COVID. So I 100% agree, because the opposite of that, the way to fix that problem that happens in so many of our chronically ill people, is social engagement. It is using your voice, talking to people, singing, even if it's by yourself in the shower, sing. It's getting on a call with Zoom. It's going out. I have so many people just now who are still afraid to go even talk to their best friend. I have somebody, it's their birthday in 2 days. They're like, can I have my best friend come over? I'm like, how isolating is that? So we want to have relationships. Sex is great, but it's that heartfelt connection. And so when I go back to heart-centered breathing, one of the easiest things to do is to just breathe into your chest. And I have people do this to go to bed and wake up all the time. It's one of the easiest, simplest, freest techniques you'll ever get. Sit or lie in your bed, start to pay attention to your breathing, whatever draws your attention, going into your nose, in your mouth, your shoulders going up, your chest expanding, and just whatever about your breathing catches your interest, pay attention. When you start to think about all the other crap, just say, cool, for the next 5 minutes, every time I have a thought, I'm just going to say thank you and come back to my breath. Then start to think about breathing directly into the center of your chest, right into your heart, and just really feel as if the breath is going directly into the heart. And it's pretty easy because you get that nice expansion and contraction of the chest wall. That's all you have to pay attention to, and just savor that. And when you get fully into that and you're starting to feel like you're breathing in your heart, think of someone or something that you love to do, that you're going to love to do, as if you're doing it right now. And if you can't do any of those, think of something you used to like to do and pretend you're doing it right now. And someone or something, and get that and breathe that love into your heart. And you'll start to feel that energy build, and you're breathing into the heart and breathing into the heart. And then have gratitude for the fact that that's a part of your life. Whether you're projecting into the future, bringing the past forward to you, or right in the moment. Feel that emotion in the moment, because if I were to put a clip on your ear or hook you up to heart monitors, you have now improved your heart rate variability through breathing. And what's really cool about this is this will reverse some of the negative effects of Lyme disease on the vagus nerve, as well as counteract a lot of what we just talked about really quickly. And you will see, if you do this over time, 5 or 10 minutes, once or twice a day, it continues to build. And as it builds, you'll sleep better. Your immune system works better. We have tons of studies, resilience to stress, physical, psychological, emotional, and you'll reverse aging. Because a lot of the premature aging we have is just stress and lack of connection. So I'm so happy to hear that you guys have focused on bringing connection and love into our lives again, because that's what we really need in this. And that's how we recover from all of these things.
Now, when you talk about connection and love, let me circle back to Lyme. So let's say somebody meets and falls in love with a person who has Lyme disease. Is it contagious? They want to hug, they want to kiss, they want to all kinds of things. Should they? I mean, how contagious is it?
That is an awesome question. So we have had researchers trying to figure out if Lyme is a sexually transmitted disease or not. Lyme spirochetes have been cultured off of the female cervix and in male semen. That doesn't mean it's sexually transmitted. We have many, many studies that show that, that I should say, cannot prove that it is sexually transmitted. There's one study where one couple may have transmitted it to each other, but it's not been repeated and we're really not clear to begin with. So a lot of my mentors have publicly argued and discussed about this. That I think consensus among most sort of conventional people's no, and most people who live in what you would consider the Lyme literate world and who do this, intensively all day, every day, is it's possible, but not probable. So I know several doctors and several patients who have found that one person's not getting better until they use barrier methods and then they get better. But for the most people, it's probably not the biggest thing to worry about because we don't have proof that it happens. I'm pretty sure it has been passed sometimes. It's just very small numbers. And I know that if you talk to the Lyme support groups, they're all going to, yell at me for saying that, and because everybody wants it to be sexually transmitted, but we just don't have the evidence that happens.
Okay, let's step back. You talked about the cervix and the semen. How about kissing? Or you know what? Let's say you went to dinner. You went to dinner with a friend. They have Lyme, and you want to taste each other's dish, and you say, "Oh my God, I shouldn't really."
Totally fine.
It's fine. So you can kiss a person like that.
Yeah. And now there are a small group of people out there who've mentioned this. I know there's some really sort of viral-ish YouTube videos where people are talking about this. It's not true. There's no evidence of it. What is true, though, is we do have spirochetes in our mouth, but they're not Lyme spirochetes, and they're not even bad spirochetes. I mean, there are some ones that are just neutral, So there are spirochetes in your mouth, but they're not Lyme spirochetes, and we have no evidence that there's transmissibility. Just like mosquitoes have been found to have Lyme spirochetes in them, but they can only live for about 5 hours, and the mosquito doesn't have a mechanism for transmitting it back into you. It's not like West Nile and chikungunya and all these other weird viruses. So there's one case report of a horsefly maybe transmitting Lyme to a person in like 1996. So has someone gotten it from a horsefly, a mosquito? Has someone gotten it from sex? Probably. Is it more than a small handful? Not to our knowledge. So I just really like to focus people's attention on if almost all, like 99.9% of all Lyme is transmitted through a bite of an infected tick. And that's where really we need to focus. We know that moms can transmit it to their unborn babies. That's real. That's been shown. It's not super common, but that of all the things we just talked about, aside from tick bite, would be the highest risk situation. So if you may have a chronic Lyme disease or you get acute Lyme, work with a provider and you're pregnant, obviously work with a provider who knows how to deal with that. But these other ones, they're one-offs, or maybe with sex, it might be 100 total in the history of the world.
even rolling back from sex. You should be able to go with your friends. You share the dish with, you kiss. It's okay.
Yeah.
I mean, that's good
as far as
for
we
people
know.
to have. Yeah. It's not just about sex,
Well,
Well, no, absolutely.
Hey, but I think what your questions are great, because we just talked about. So the thing is, with that fear of I can't win, one of the other things we know from looking at the nervous system that way is if you don't feel safe, you're unable to heal. And the lack of feeling safe is from two main things. One is your physiological condition, like the infection, and from knowledge base, right? And I'm not saying that any of these things we just talked about doesn't happen as a fluke, right? But it's just not as common as the underground may make it seem. So I want people to understand when to be safe. And like you said, if you feel scared to hug and kiss your friends because, that's a shame, and we don't need to be from a Lyme perspective.
That's quite interesting that you mentioned it on a very small scale. You just reminded me of something. I don't get a lot of flus, but in the past, if I had the flu, when you get out of it, there is a weird window that you just kind of triggered. You're sick, you're not feeling well, but then you start feeling better, but you're still sick. And there is like 1 or 2 days where you are still in sick mentality, but your body is already well. And you go on as if it's kind of a weird window that you just kind of reminded me of. Is that?
Yeah. And I mean, I think it's part of it is you were sick and you're like, am I really better? And can you imagine somebody who's sick for 5 or 10 or 15 years and the whole system has told them they're wrong and they've not validated that they're really sick? And one of the things I think is beautiful, polyvagal theory is a great conversation to have, which is what it's called for the sympathetic, parasympathetic, and that freeze state we're talking about, is it really is a reflection of the repetitive patterns that your brain has been in and your emotional, what they call the limbic system, the emotional part of your brain has been in over time, and you get in the cycles, right? And so part of the cycle breaking is getting rid of the original stimulus, getting rid of the infection, rebuilding the immune system, getting you to start feeling better. But then we'd have to have that period of time where we actually allow your mind and your emotions to heal. That doesn't mean that you're cut from lesser cloth or that you don't have any chutzpah or whatever. It means you were sick for a long ass time and your brain is still in sick mentality. So if you have a flu for a few days, it's a short window. If you've been sick for 15 years, I mean, if you're not working on that actively, it can be really challenging, and so that's really a key to healing and that's why I tell people, it's like, I want people to know my story. And we didn't get into huge detail, but I was sick for 13 years before I recovered, and 8 before I even knew what the hell was wrong with me. After I got the classic diagnosis of Lyme and I was given my 10 days, you're good to go treatment. And they told me it was all in my head, the psychiatrist, the this and the that. And all that went away. It all went away. But I was still like, is this Lyme? I've not had a symptom for 11 years. And I tell people that all the time because 2 years into feeling great, I was like, when's it coming back? When's it coming back? Because I just spent 13 years fighting this thing. And then it was like 5 years. I'm like, all right, and I do a lot of mindset work. So I always was looking at my goal. And I saw my life as a person doing things that were incompatible with being sick, even when I could barely move. And I feel really lucky that was where I came from, but it's not always easy. And in Lyme, we talk a lot about it, like limbic retraining and this thing and that thing. We need to just sit down and write out our goals, put emotion and positive emotion behind it, and really move in that direction so that it's as important or more important than our antibiotics and the foods we're eating. It's all part of that one system that's you, body, mind, and spirit. And the people who poo-poo that part are the ones that take forever to heal. And the ones who focus on all of it together in the levels that they can handle in the moment are the ones who get better.
Well, there's so much that you gave us, and I was going to ask you about mold, but I feel we've already gone very long, and I want to talk about mold, and I want to talk to you again if possible.
Absolutely.
So maybe we'll invite you again and talk to you again.
That would be an honor. Thank you so very much.
So, Dr. Tom, I want to thank you literally from the bottom of my heart. Thank you so much. You gave so much. We learned so much. And I know that many people who view and listen to it are going to benefit. Thank you so much for being here.
It was an honor. Thank you so very much for having me.
Thank you for joining me today for the second part of our amazing interview. If you didn't catch part 1, don't miss out. The link is in the description below for you. And be sure to click the subscribe button for more videos.